Good morning, everyone. Um, Thank you, KSOS, for the opportunity. I do not have any financial interest. That is my disclaimer straight away. So I'll try to conclude fast. We know glaucoma is important, right? A silent thief of sight. It's an important, it's a very difficult task otherwise itself. I'll try to stick to the relevant topic. You know, IOP is important because it is only modifiable risk factor. We have eye care system. The newer one allows us to measure the IOP even in the supine position. That is one thing important. We have home eye care, so it allows you to measure the IOP even at home and record it in an application, and you can send it to your doctor so they can follow up. Now 24-hour monitoring is a new thing, so you can use a contact lens which detects the 24-hour IOP, and then it can be recorded. Implantable IOP measurements are also there. In the IOL, you can implant that IOP measurement mechanism and that can be detected. Coming to visual fields, the SETA, we are already familiar. SETA has become faster. 24-2C program is there. A person who has done the SETA normal test multiple times is not doing it properly. Now we have done the 24-2C SETA faster. See, the time is very less and the false negatives are also very less. Patient was very comfortable. It's a life of virtual reality now. It is the life of virtual perimetry also. Just a headgear, an iPad, a clickable button. Many patients can do, no darkroom required, anywhere you can do. Similar visual field output, easily understandable. You can take anywhere you go. Keep it in a bag, go, do it. And a printable report which can be easily understandable by anybody. AI has come to disk assessment also. Take your phone with an AI inside. You don't even need an internet for that. Anybody can take the photo with a handheld device. What the phone does, what the program does, takes the disk and cup disk ratio, identifies the damaged area, says whether this patient needs to be referred to a glaucoma specialist or not. Your job is done. Nothing to, with high sensitivity and specificity, even better than the glaucoma specialist sometimes in identifying the sensitivity. In OCT, what is new? It has identified the vessels. So why is it important? You see how dense is this blood vessels here. And in a moderate glaucoma where there is an RNFL defect, you can see the drop of vessels in that area. And in advanced glaucoma, you see what? A complete drop of vessels. So vessels are mapped without dye, without injection, non-invasive, very important. Coming from diagnostics to medications, newer medications are coming up in glaucoma. Fixed dose combinations are coming up. Preservative-free medications, sustained release medications. So Rho kinase inhibitors are the newer medications that are available to us. The ripasudil, netasudil. Ripasudil is 2 times. Nepasudil is once daily. Tell the patient you will have redness, irritation. Otherwise, patient will come back telling you that I have put the medication, very much redness, I cannot put that. If you want the patient will not come back with that complaint. But do tell that patient, that is the most important thing. Another thing is like patient can have epithelial edema. Don't get worried. If you stop the medication, immediately that epithelial edema will go off. It can be seen on the ASOCT also. We have stopped the medication and the second picture, we can see that the epithelial edema has gone off. Rocklatan, which is a combination of prostaglandin and ROCK inhibitor. Another medication, once daily medication. Over and above prostaglandin, you have additional IOP drop. Not available in India currently, but this is a medication of importance. Another PGA type of medication, because of dual mechanism of action, additional drop in pressure. First triple drug, we are familiar with timolol and other combinations, double dose combinations, we are familiar. Now 3 medicines comes in single bottle. Number of medications less, easy, compliance is increased. Preservative free, compliance is increased because ocular toxicity is the main challenge a glaucoma specialist faces. If you give sustained release medications, better, because you don't have to put the drops again and again. Compliance increases. Glaucoma, better treated. This is intracameral insertion. Again, compliance is not a problem. SLT, so selective laser trabeculoplasty is equal to medications because now it is considered primary therapy itself. But the challenge is you have to do a proper gonioscopy. You have to have good knowledge of gonioscopy. That is the limiting step. and comprehensive ophthalmologist cannot do that because of the limiting step of gonioscopy. If you have direct of SLT, you don't have to do gonioscopy. You can directly give. So it becomes doable for everybody.
Ma'am, can we conclude?
Thank you.